We're continuing with the English language as Audientes is next in line here at Aktieportföljen to present here live. With me I have Steen Thygesen on link. Good day, Steen.
Hello.
You've prepared a presentation as the other companies have here today, so without further ado, I'll simply hand over the word to you.
Well, thank you very much. It's a pleasure being here today. Audientes is a Danish technology company specializing in hearing health, and in particular hearing health solutions and products for the very people-rich markets, countries around the world. And we have been active now in you can say addressing this worldwide hearing health challenge now since 2014. But we have been in the market really since early this year with our initial product. So I look forward to take you through that. We, of course, have also a rights issue right now being in the subscription period. So I will also go through that a bit later on in the presentation. Basically, founded back in 2014, we have been really on this, you can say, classic journey of finding out how to address this big issue of hearing health in a new and innovative way. We have been funded through angel rounds and some grant funding from Danish kind of market development funds. So we have really been out testing our solution in the market in India actually since 2018. And we got listed back in 2020 on the Danish growth market, First North. We changed earlier this year actually to the Spotlight stock market in order really to grow our investor base in the Nordic countries and participate in the kind of vibrant Swedish market more fully. So we are now, I think, at a very exciting stage. And I kind of wanted to explain a bit about why is it that we are focusing on you can say these parts of the world far away from our own hemisphere. And it is because according to WHO, there is this very large number of people in the world of around 450 plus million people today that has disabling hearing loss. And the largest part of those are actually based in countries in Asia, very large countries, but also countries where the infrastructure as it concerns hearing health is not as advanced in other parts of the world. So there is just a very high proportion of people there who are basically going about not hearing as well as they could and should because they don't have a good solution. Now, this is what we have been really looking into, and we have been this year rolling out our initial product called Denna, which I, of course, will come back to since Q1. And we have built up a quite solid platform now for distribution and selling the solution in India. So today we have signed up more around 80 collaboration partners, which are basically retailers and distributors of varying size. And to all taken in total, they have around 500 points of sale where we are working on making our product available through. So today I think we have a very good platform established, and you can say, looking back at our IPO, these are the operational milestones we set out at that point in time. Now, you can say commercial breakthrough is what we believe we are achieving this year. We have started to generate revenue. We have been putting the product out there in the market. It's in the channels. It's validated in particular through the professional hearing clinics, because that's where we have focused on making sure that when people are being exposed to the product, they can get the right level of support. Now, it is a quite novel innovation because it's a self-fitting hearing aid. So in theory, you don't need that much expert assistance to take it into use. But we have learned through the testing period that that's where people go and look for the initial advice. So, but again, I will come back to some of this. And now we are at this, you can say, new next threshold where we are about to introduce our new product for a different set of markets, basically consumer electronic channels and alike. And that product is called Companion by Audientes. So we feel we are at this point in time where we really have advanced well on our vision to make sure that everyone in the world with mild to severe hearing loss has access to an affordable quality solution for their hearing loss. Now, coming back to this, I mentioned this already, very large number of people today with disabling hearing loss, and the number is just set to grow. WHO are projecting that in 2050, there's around 700 million people in the world that has disabling hearing loss. The problem today is that the existing industry sells around 17 million hearing aids per year. Now, since most people really need 2 hearing aids for good kind of alleviation of hearing loss, you can imagine there is really only maybe 10, 11 million people in the world that get a good solution every year. And that problem, you can say, the industry is not set to address that. The gap will remain even in the next 20, 30 years. So that's, of course, a huge problem. And why is that the case? Well, there are some inherent challenges in how people are having their hearing loss addressed today. Now, partly it's due to the cost of the product. Now, in Denmark, we have 3 of the world's 5 largest hearing aid companies, and they all produce magnificent quality products, but they're priced very high. In the US, they say the average price of a hearing aid is around $2,400. So you can imagine like paying $5,000 for a set. It's not an option for people in many countries in the world. In Denmark, and I think in Sweden as well, there is support for people to get a hearing aid with support from the kind of social kind of welfare system. That's not the case in most countries in the world. So for many people, getting a hearing aid is a high investment, but it's also high cost in use because most people have to change batteries once a week in maybe both ears. So this adds up to further costs on an ongoing use. But one of the biggest problems we have found in countries like India is that there is a shortage of hearing experts that can help a person with hearing loss. So what the problem is that if you cannot afford to travel maybe for a day to get into a city to see an expert, you will definitely not get anyone to help you with your hearing loss. So what people do, they resort to less costly solutions that unfortunately are not very good for their hearing because they're amplifying too high across the frequency spectrum and damage the areas where people can hear even further. So what we have been trying to do is to look at the overall process and saying, well, what can we do to improve how things are working out in those locations, those geographies, but also even closer to home? What can we do to help people, maybe in Denmark or Sweden, get easy access to a hearing health solution that is a good fit for them? So we have, you can say, we introduced the Audientes self-fitting way. We have essentially digitalized the entire process, and we have built in all the works of a hearing clinic into one product. So today we have been out marketing this solution. Our solution today, the product is called Ven. Of course, being from the Scandinavian part of the world, most people know what Ven stands for, but it's a name we have been basically trademarking for marketing the product in different countries. It works really well in India. It's quite easy to pronounce. And when people hear what this story is about, a friend who will always be behind you, they really understand what this product can do for them. But in India, Ven is a regulated product. It's something that comes under this sort of, you can say, hearing aids category, and it's being sold as a hearing aid. What we're doing now, we're expanding the product portfolio with a product that is physically quite similar, but is being, you can say, amended through software to be more of a hearing kind of assistant, a companion device that people can use to enhance their hearing in different situations. And also, you can say, maybe get on the trajectory of having a hearing challenge addressed early on in life. So it fits in this category of what is called advanced hearables. So it's products that has got, you can say, hearing enhancement as a key feature, but also doubles in many other ways, for example, as a streaming device for listening to music or storybooks and TV through essentially a wireless Bluetooth connection. Now, in our case, if we just start with Ven, Ven being the product that is in the market today and selling today, so what we've been generating revenue from today, it is sort of a product that essentially addresses hearing loss on both ears. It has got a built-in hearing test. And once the person has run the hearing test, this, you can say, self-fitting approach means that the product will calibrate its amplification according to the person's hearing profile. It has been measured by the person running the hearing test. So it's actually a very straightforward solution that means that in a matter of 5 to 7 minutes, the person that has taken the hearing test, put the device on, is up and running with a fully fledged hearing aid solution for 2 years. Now, it also has this feature of being basically able to stream music and sound and so on, calls from smartphones and TV. So it means that if you have hearing loss, our product will actually fix the sound reproduction in the frequencies that the person typically cannot hear very well. So it's a great solution for anyone with a hearing loss that wants to also follow what's going on in the world around them. So, and it has all the hallmarks of a hearing aid, including kind of like feedback reduction, rechargeable battery, and it's priced, I can say, in sort of international markets, it'll be selling around $350, maybe a bit more in some markets, but that's the price for that. And compared with, as I said, a product that maybe cost $2,000+, it's definitely per 1 year, it's a good solution at a very affordable price. Comparing with Companion in a very sort of simple way, Companion is then this situational hearing device that fits in this advanced hearables category. And for us, it's a way to participate in new markets. Essentially, all the, you can say, quality hallmarks of our audio reproduction is now being built into a device that is orientated towards new channels. So for new channels for us is more like the kind of pharmacies, opticians, consumer electronic stores, and alike, as well as, of course, online retail, which is you can say a market that this product is very, very much fitted for. We're going to introduce this in Europe initially, and then we're going to start marketing it in USA as well as in Japan, that we're working on localizing the solution for right now, and of course on other markets globally where this solution can participate. It's not a regulated device, so it comes in under general consumer electronics, you can say, guidelines, whereas Ven is more in the medical device space, and we will be enhancing that product to participate in markets like the US, where there is a new set of guidelines for over-the-counter hearing aids requiring FDA approval and so forth. So this is, you can say, the way forward for us. We have kind of 2 tracks for us, which we think is very interesting because it gives us at least 2 legs to stand on in that sense. Now, go to market. It's, of course, very important for us that we have ways of finding an end user for our product. Now, you can say the business model that we are employing is kind of like a classic solution-oriented, where we have got, as a manufacturer, we have got a series of channels to reach the consumer market through. And we have been in India selling through online channels, our own site, as well as the leading e-tailers in that market like Flipkart, Amazon, and IndiaMart. In Europe, we will be doing the same through our own site, but also through Amazon and so forth, as of course also in the US. But otherwise, many of our retailers and are also having their own e-tail sites. So in some markets, it doesn't make sense for us to go in and set up our own presence. We will be, of course, working through our local partners. But the model we have really been investing most in developing in India so far has been the classic retail model, as I mentioned earlier. So working with distributors and wholesalers on essentially broadening the product in those channels. In India, anyone with hearing loss will typically consult their doctor, which is called a general practitioner. And we then see them being advised to go to a hearing clinic for advice, or maybe an ENT doctor, which stands for ear, nose, and throat. So essentially, they'll get this expert advice, and they will at some point turn to a hearing clinic to ask for what solution should they go for. And that's where the hearing clinics have been assessing and validating our solution and found out that this fits very well in their portfolio of higher priced devices, but more as an entry-level solution. Essentially, if you can imagine, at a price point significantly below what else they have in their stock, but also a different kind of use case. It's more of a kind of hearing device that people can start using early on in life at a more affordable price. And then they can use it in a variety of situations supporting their day-to-day life. So it's something that we can see is starting to work quite well. What we're doing right now in India, for example, is broadening our availability in channels such as pharmacies, and we are also looking into optician chains. So essentially places where people go to consult with a wide range of health-related issues, and hearing is actually one of them. We're also exploring working with NGOs right now in India. There's some quite large kind of like charity organizations that are working with people with disabilities on essentially helping advise and procure solutions for them. So some of these NGOs that we are talking to is actually channel partners of us, as well as they do screenings for hearing loss. And they will then typically try to provide a solution typically a solution that has been sponsored by one of their corporate partners. So this is really interesting for us to participate in that. And I would say this model that I'm presenting here is the one that we are looking to also employ going out in other markets, of course, tailored for each local situation. So the international growth strategy that we are following really has to do with, from this presence in India, we are looking at surrounding countries in India right now. I mean, including Bangladesh, Sri Lanka, Nepal. The local team in India we have in our subsidiary there are essentially taking care of that as well. But there's countries like in Asia, like Japan, and there's other, you can say, a wide range of other countries from Thailand to Indonesia, Malaysia, Vietnam, that we also have been looking at, and what does it take to introduce our solutions there. So in the coming years, we'll be continuing to be active in that region. But otherwise, what we're looking at right now is, of course, introducing Companion starting next year in the US market as well as in the European market. So Companion will be available to purchase in the European markets, such as Denmark and Sweden and so forth. So and over time, we will be introducing the hearing aid versions like then, also in the US market, and of course in markets in Europe as we are getting the required certifications. Medical device, it's a longer journey, which is of course why we think Companion as a consumer electronics device makes a lot of sense to already start launching now in the markets. Now, as if any of you have been seeing our current prospectus that is out, you can download that from our website. We are targeting really a situation where we will continue to grow every year, on this base that we are creating this year. So our expectation and aim is to grow around 50 to 60% annually in terms of revenue. And how will we do that? Well, essentially, we will continue to scale the business in India. So from these points of sale we have today, really growing that, but also penetrating the market much further. So it's not just new hearing aid clinics, it's also channels through pharmacists, opticians. So we really will be starting to get the product out there in the market and into the hands of more and more end users. But launching Companion, of course, means that we are now also in a situation where we can start playing in markets in the Western Hemisphere, US, Europe, as well as in countries such as Japan. We're also working on securing a quality certification called ISO 13485, which is kind of critical in order to produce medical device products. So, of course, that's part of our trajectory. So we are continuing to focus on securing that certification next year. Otherwise, if you sort of follow this trajectory outline here, we will continue to enhance our presence in the key markets that we're in. We're going to expand the retail points of sale so that by 2025, we should have around 2,400 retail points of sales around the world. We will be also entering new markets in Asia and Latin America. Of course, this is very much logical. There's many countries in Latin America that has got similar demographics as many of the Asian countries, and we see interest there from countries such as Chile and Brazil already. And we are basically, just as we are developing and we have capacity to do so, we will enter these countries typically through partners who will be distributing the products locally. Other markets in the longer term, like China and in the Middle East and Africa, they're very much on our mind. We are, of course, cognizant of the fact that as a smaller company, we can only do so much every year, but we will continue to pay attention to what it means scaling in existing locations as well as entering new markets. So this is, you can say, we have the work really now outlined for the coming years, and that is what we are now raising funding to the initial part of that journey next year in 2023, really going out and getting that presence in the market that we are expecting to get. Now, if I'm sort of now switching into another part of the presentation, I'm also switching language, at least on the slides. We thought it would be nice, since we have part of our material already made in Swedish, why not just also present this to you so it's very easy to follow. I will continue, though, to speak English. But our rights issue, of course, is aimed at not only existing shareholders, but other people can, of course, also subscribe to shares, and provided that there is, you can say, opportunity to be allocated, of course, people will be allocated shares. We are hoping to expand the shareholder base significantly. We have around 3,000 shareholders today, predominantly in Denmark, I would say, but we're really hoping to also expand now into Sweden. The rights issue is running until the 15th of December, and it's being complemented by a series of warrants that will also be, you can say, open for subscription or utilization in the late March, early April timeframe. I'll come back to that in a few slides. There is, however, people who are wanting to utilize their subscription rights have to do that until or before the 13th of December. And I think it's quite important to notice those dates. They are, you can say, not exactly the same as the overall subscription period, but it's something that people have to really pay attention to. What we are hoping to get from this emission is around 14 million Danish kroner before the cost of the actual transaction. And as in the following utilization of warrants, there will be an opportunity for us to also get further around 10 million in that process also before transaction costs. Now, a concept that I believe is much more known in Sweden than in Denmark is the concept of a unit. So what we have done in this round, we have been trying really to make it attractive for our existing shareholders as well as new ones to get on board and help support our mission and really enable us to achieve the goals that we have sent out. So we have made, you can say, what we believe is a quite attractive offer, combining 2 shares and 1 free warrant for the price of 1.5 Danish kroner per unit. And as I said, there is some timelines that are shown here on this slide that are important to bear in mind. But otherwise, we hope that this concept will be really making a lot of people interested in joining as new shareholders in Audientes. What we are aiming at doing with this initial emission is that part of that will be used to settle some existing debt, but the bulk of that will be used to invest further in India. So basically introducing Companion in some of the countries in surrounding India, but otherwise in India, really focusing on marketing and selling then will be around 15% of this. I think it's important to say that we have a subsidiary in India today that is a very cost-effective operation based in Hyderabad, and of course with people in several other locations such as in Delhi and in Mumbai, and we'll be continuing to grow that organization a bit, but otherwise it'll be responsible for driving then out in the different channels and into the hands of end users. Whereas it concerns new markets like Europe, USA, and Japan, we see that the larger part of this emission will be based on actually getting the impact on those markets. So really investing in go-to-market, marketing and selling it in those countries, of course, will be done typically by local partners, but we will have quite a lot to do in bringing it out there and supporting them. And then, of course, we'll be continuing to develop new features and new products as well, and achieving those certifications, including the ISO 13485 and other things that are required for introducing the products under kind of the medical devices rules. And then finally, of course, there are some other costs that will be borne by the company that this rights issue will fund as well. Now, coming to the next part, the second part of this rights issue, essentially the warrants in a series called TO1. So it means that anyone who will be purchasing units in this rights issue will get a warrant that can be utilized in this period from the 27th of March until the 13th of April. And there's already been set some you can say terms around this warrant that I believe you can see it here for yourself on the slide. But essentially, when it's being utilized, the actual you can say the price for the warrant at that stage will be priced around 70% of the sort of the volume weighted average cost for the share, leading 10 days up to the to when the sort of 2 days before the utilization period starts. It's a bit complicated, but essentially it means that there's already a built-in discount at this level, but there's also an over you can say, top limit set already of 1.1 Danish kroner. So I think for anyone investing in units right now, this should be a quite attractive proposition. That's what we have been aiming at doing in setting this, you can say, bundle together. Now, any other information that is required around the actual offer can be found on our website by downloading the prospectus. And there's also a short form document that can be downloaded as well. You can also find information about the rights issue at Nordnet, for example, and at cedarmere.se, our corporate finance partner. So there's a lot of opportunities to find out more about this rights issue and maybe decide on whether to participate. Of course, we hope you will. And I think there are really 5 key reasons for why Audientes represents a really interesting and high potential investment. First of all, the market that we're addressing, it is really huge, and there's a huge gap that no one really is addressing in the markets that we are going for. Of course, there are solutions, but we have got this, you can say, laser sharp focus on addressing hearing health in a population that is consisting of hundreds of millions of people around the world that no one really else is paying that much attention to. Now, you can say we're also venturing into other markets, but our core focus in the middle income countries is very, I think, one of the unique things about us. Now, there is this growing need for solutions in those markets, accessible, that you can actually find, you can get access to, and affordable, that you can actually get on using in different ways. And this is, you can say, one of our hallmarks again, a cost-effective solution that is easy to use, has built-in self-fitting. Now, as a young company, of course, we are part of disrupting how the traditional industry has been working for many, many years. They're used to high margins, they're used to high prices, and they're used to also being present in predominantly high-income Western markets. Of course, their products are available in other places as well, but essentially not for most people in those markets. It's not a real option. Now, we have to date, you can say, achieved what we call the initial commercial breakthrough and validation of the concept in India. And now we are taking that to the world through the companion device and over time also through Ven, the hearing aid, in new markets. So it means that today we are standing with an expanded product portfolio from just basically a year ago. We are now able to participate both in regulated markets like in the India market, and then of course in non-regulated markets, including markets in our own part of the world. We think this is super exciting and of course another good platform to stand on in our point of view. And maybe my final sort of few words on Ven here is that we believe Ven represents a paradigm shift in how hearing health is treated. Many more people can get access to a solution, they can acquire it and they can use it and get up and running in a matter of a few minutes with a good solution for hearing loss on both ears. Now, if we are, you can say, succeeding on our mission, we are able to help millions of people in the world lead a better life. And that's why we believe that this also is an investment in better hearing health, and therefore it's a sustainable business that we are now bringing out in the world, addressing issues like poverty, good health and well-being, and also we are reducing inequalities, meaning that people with hearing loss are not standing on the outside looking in, they are participating in the conversation. So this is why we are putting a lot of emphasis on you can say, the other elements, the other impact that we have in what we're doing. And so I think we are now coming to the end of my presentation here. I would like to thank you for listening in, and I'll be very happy to take further questions now from the moderator. Thank you very much.
Thank you as well, Steen. We don't have much time for questions, I'm afraid, but I will give you one if you could be a little bit brief. New product Companion that you're launching, you currently have sales in India, which is a big market for you, when you expect the Companion product to launch in Q1 of 2023. But this product will launch in European and American markets. How come you're not launching this product in Indian markets?
Well, as I said, we already have a product in the Indian markets in the Ven, and Companion is actually made for non-regulated markets. So while we think there are some opportunities for it in India, that is not what is our key focus. Our key focus are markets outside India and in the area called non-regulated, so consumer electronics. So it is it's not really something that I think is something that we would be putting a lot of effort into in India, but in some of the countries surrounding India, it might be a good fit. Yeah.
Well, Steen, thank you very much for your time and your presentation. It was very interesting to listen to, but we must move on here at Aktieportföljen because the next company is